Hello, and welcome to the Ask Nurse Linda webinar. It's nice to be here with you today. It's the end of the year, December, which is always the time when I like to stop and think about what's happened over the last year and what's coming up in the new year. And we have been in the community of individuals with paralysis. There have been so many announcements of this is coming and that is coming. And we wait, and something happens, and whatever it is, the excitement of the time does not occur. And it's always a big letdown, and then it kind of dies out. So people kind of get the feeling of, yeah, we've heard it all before. However, this year of 2024 is going to be a bit different because there are things that are going to be released to the public. And, science is exploding, research is exploding right now. I think people have had some time to contemplate and to really focus on the research, and it's been building for years. And guess what? It's starting to come to fruition, which is a shock. And I know everybody's sitting out there saying, I've heard this all before. And, we're always let down, but in actuality, guess what? Things are coming, to a really nice conclusion. I also think this time of year is a good time to talk about ourselves and to think about ourselves and what we've done in the last year and what we're going to do. The changing of the year is a man-made phenomenon. Man created a calendar. It goes with the year. It's a good way of messaging, setting boundaries and changes in time. But as we come into the new year, it's time to start thinking about, maybe take an internal review of what's going on in your life and think about maybe what you'd like to change, and then think about how you're going to do it. Making a change in your life is not an easy assignment for yourself. It can be very, very difficult. It can be very, very overwhelming. So think about maybe what you'd like to change and then break it down into some easy steps. And remember, if you decide to make a change in your life, it is not going to come overnight. You're not going to sit there and think about it. Well, I'm going to do this differently, and then tomorrow it will all be different. No, it takes time to think about things. So right now in our country and really around the world, there's this epidemic of loneliness. And so I was reading about this epidemic of loneliness because I think, gee, I know a lot of people who are isolated because of their conditions, and they can't get out so well. And it's snowing at my house today, so I'm not going to go out in that because the traffic's going to be crazy. And it's this post-holiday time, or maybe you're just getting ready for the holiday that you celebrate. And so it's kind of crazy to be out on the roads when it's all wet. And if you're using a wheelchair or you need some kind of mobility accommodations, it can be very tricky to be out in this kind of weather. So people get isolated and they become lonely. And that happened a lot during the pandemic. And then when the pandemic was over, people found it difficult to go back to their life as they knew it before. And so there's this epidemic now that they're terming this new epidemic as loneliness. And so I thought I better read up on this. Maybe we should talk about this. I've written about it in different forms using different words, but I thought maybe we should think about this. So I'm reading this article about loneliness, and I thought, oh my gosh, they're talking about me. I'm lonely. So it happens to everybody. So I had to think, okay, what am I going to do about my loneliness? So I started increasing social circles, which is not always easy to do depending on your situation. If you're not involved in any organizations or any clubs or groups, it's, how do you go out and meet new people? So think about, if you want to join an organization, if you can't go out of your home, there's an abundance of opportunities online to join different groups. Be sure that if you join a group, be sure that it's on some kind of website or being moderated by somebody, because you don't want to get in a group where, somebody's going to befriend you and then take all your money or abuse you in some way. So, be very careful. Just because somebody says hello does not mean you're going to be best friends for life. But be very cautious, but, slowly get out, start meeting people. Start talking to different people, talk to people over the webinar chat. There's the peer mentor support group. If you've not been involved in that with the Reeve Foundation, I was just in Dallas. Oh, I think it was last month, and that was a fabulous program that they had at the Abilities Expo. But they also had a meeting of the peer mentors. And I mean, this was just a great time because we weren't there to discuss issues, although some people did bring up issues, and that's fine. If they had something weighing on their mind, that was good. But it was just a real good group of camaraderie. And I met a lot of the peer support people. And I thought, yes, if I needed your services, I would be delighted. It's a free service, so it helps you connect with people in that way. And then they also have tips for how you can get around in the community in which you live, because they live in that community. They can tell you of different organizations and activity that's going on. Just because you have paralysis does not mean you only have to live within the paralysis community. You can join hobby clubs or, all kinds of different interests that you might have, maybe in politics or maybe in volunteering. So there's just ways to meet people just all over, but you have to put yourself out there. And just because you go once does not mean you're going to meet anybody, does not mean you're going to find new friends, but keep going and keep going back. It takes several times, opportunities to keep going back and keep going back. And pretty soon you're going to find people of variety of interests that maybe you didn't even know about. You can get involved in those as well. So this is the time to think about that. If you have something you want to change in your life, think about how you're going to do it, and then take the baby steps to doing it. So, if you want to change the way you face the world or your look or your style, get a new haircut, or, if you want to do something different physically to how you look, or if you want to go out and meet people, think about baby steps and know that the first time you go, maybe not the second, maybe not the 10th or the 20th, you might not reach success until you've been many, many times. So don't let that get you down if it doesn't come right away. Sometimes it takes a while for things to turn around in your life. Another thing to think about is your mental health and how you're dealing with being isolated or cooped up in the weather, or you can't get out as well. And think about your own mental well-being. Thinking about your mental well-being does not in any way indicate that you're not mentally well. It just is a way of thinking about, this is really kind of bothering me when my computer doesn't work. That really bothers me. So I was having a lot of trouble with my computer. Hopefully it's all fixed now. That's very frustrating when your computer doesn't work and you're relying on it. Think about yourself and how you treat yourself mentally. Do you have a lot of negative talk in your head about yourself? Start thinking about something positive that you can focus on. That I do this really well. I'm a really good friend. I'm a really good listener. I'm really supportive. Helping other people is one way that you can really find a lot of self-satisfaction. So think about whatever it is that you want to change in your life and how you're going to do it. So every time you have a negative thought, think about a positive thought. I used to have a lot of negative chatter in my head. And that doesn't mean that I go around now and say, wow, Linda, you're really great. But I have tried to diminish those. Oh, you won't be good at that. Oh, I shouldn't talk to them. I don't know if I would be up to their speed, Instead of just thinking, I can give yourself a pat on the back and say, I can do this. Let me try to do this. And then review, what could I have done better? What will I try next time? So there's all different ways you can kind of help yourself. And so that's an important thing to do. I like to do it in these big demarcations, like at the change of a year. What kind of things do I want to change for my life in the next year? And then try to start to work on those kinds of things. Sometimes I'm successful and sometimes not, but there's always some kind of change that goes on, and sometimes it doesn't play out. Most of the times it doesn't play out the way I imagined it in my head, but it might even turn into something better that you never even thought about. So consider those kinds of things. Now let's get to some of the questions, because we've got some great questions here today, as always. So the first question is about a person who are written in, and just recently they've noticed that the palms of their hands are very sore. They're achy and sometimes throbbing. Do you have any advice for that type of pain? Well, it depends on pain is caused by something that's going on either inside the body or something that's going on outside the body. Now, this person doesn't write in if they're using a manual chair or how they're using their hands. But when I think of the palms of the hands, the first thing that comes to my mind is that sometimes when you're pushing your wheelchair, especially if you don't maybe have so good finger function, that people use the palms of their hands to push their wheelchair and their hands get very sore. And it's very easy to help that. A lot of people will get what's called weightlifting gloves. They're gloves, you can go to the sporting goods section and get them. They're not really too expensive, but you can just go to any store, go to sporting goods, and they have padding in the palm of the hands, and they have a place for your fingers and thumbs, but they're cut off. The gloves are cut off here. So your fingers are still very able to be used, but they've got this padding that comes here. And they're called weightlifting gloves because weightlifters are doing that weight with the palm in their hands, but other people use them for all kinds of things. So when my daughter was growing up, she was in color guard and they used weightlifting gloves to manipulate the poles and all that because that slapping against the palm of their hands really would begin to hurt. So that padding there was extremely helpful. So that's one thing to think about with your hands. Now, sometimes if you're having contact with something, you might be allergic. If you're pushing on your wheel and not your rim, you might be allergic to some material that's in the wheel. And so that could be something that's aching the hand as well. Or if you think about how you use your hands, it might be something that you're doing, an exercise, or maybe you're pushing on the palms of your hands that's causing that soreness. So look at the mechanics of what's going on in the hand externally. And then think about what might be going on inside your body. So people don't often think about different issues that happen within the body, especially if you're using your hands externally for a lot of different things. Sometimes people will get right here in their wrist. They'll get pain, which might radiate down into their hands. But sometimes they'll get a nerve entrapment right here. You've heard of people that do repetitive work that get carpal tunnel syndrome. So sometimes the nerves that travel right here, and there's a little tunnel, because this is the carpal, and there's a little tunnel inside the body right here where the nerves to the fingers travel through, and that tunnel can become tight and it presses on the nerve. And so that gives some pain and discomfort. If you have pain in the ulnar nerve, it's these two fingers that will tend to get tingly. If you have pain in the radial nerve, it's these two fingers that tend to get tingly. And so sometimes that might be something, a nerve entrapment. You can also get entrapments at the elbow. You can get them up in your neck. You can get them in your knees. You can get them at your ankles. So everybody knows about carpal tunnel, are pretty familiar with that. A lot of people don't know that there's a lot of places in your body where you can get nerve entrapments. So that could be an issue. It could be neuropathic pain, which is the nerves are transmitting pain in the palm of your hand, or maybe in your fingers, but your brain registers it as pain in the palm of your hands. And so neuropathic pain is one pain that can be treated with medications. And so, that might be another thing too. So isolating what the source of that pain will be a challenge to find out for you what is causing that pain. You might need to talk to your therapist to see if you're, putting too much weight through your palm of your hands, or if you're doing something, pushing your wheelchair that is making the palm of your hands hurt, or if you have an allergic reaction, you might need to talk to your healthcare professional about it. Those are just some of the things that can cause pain in the palm of the hand. So it's not at all unusual And there's a lot of real common sources for that. So those are just some of the common issues with pain in the palm of the hands. But it could be something that, I didn't mention. It could be something quite unusual. So work with your healthcare professional and kind of isolate what that is. And I think you're going to find satisfaction for that. So there's a question about a person who has a question about a decubitus ulcer on the left buttocks extending to the left ischial tuberosity. So they have osteomyelitis, that's infection in the bone there, and myositis. I'm not speaking myositis. So infection in the muscles around that area, and so I think they're looking for some help for that. Looking at what can be done for treatments for that. So the first thing that will need to be done is to treat that infection. And for that, you'll need IV antibiotics. They might put antibiotics in the wound, either separately or as well with IV antibiotics. And so the infection has to be cleaned up first, and then the wound has to be healed. Wounds, pressure injuries always have to be healed from the inside of the body to the outside of the body. You don't want that skin to close over. We always want the skin to, usually in most cuts and scrapes, you can't wait for the scab to come. But if you have infection in there, or if you have a pressure injury even without infection, once the skin closes over, that just makes a breeding ground for that infection. If it's already there, it's going to thrive. If it's not there and the skin closes over, it can develop in there and just create further abscess. And, the infection can spread throughout your body. You can become septic. Be sure and have the sepsis wallet card from the Reeve Foundation, the deep vein thrombosis card, and the AD card at your ready at all times. So you can print those off for free right from the Reeve website. But looking at the sepsis card is going to be very important to know if you've got this infection in your wound. When it spreads throughout the body, that's becomes sepsis, and that's very critical. So you need to have treatment for that right away. So always, if you feel like your infection has spread, or you're not feeling well in some other parts of your body, or you're just not feeling well at all, be sure and mention to your healthcare provider when you go to the emergency room, when you go to your doctor, could it be sepsis? Put that in their head. Put that each time you see them. Could it be sepsis? Could it be sepsis? Somebody else walks in the room. Could it be sepsis? It's very important, because the way infections are treated is they start with the simplest and they work up to the most complicated. Sepsis is the most complicated, but it's very fast acting. So if they're working at the basic level and they keep working up, your sepsis could take hold before you get to the sepsis treatment. So always mention, could this be sepsis? Could it be sepsis? Be sure and do that. So that's an important thing to do. After that, if you get that infection cleaned up, you want to keep that wound area, clean. You might need to pack it to keep it so that it's healing from the inside to the outside. The last thing in a pressure injury that's open that should close is the skin, because you don't want to create that microbiome in your body for that infection just go wild. So that is the way that they're healed. They start from the inside and work their way to the outside of the skin. So being sure to keep that skin open is going to be an important part of the healing process. Stay off the area, and people, oh, no, I have to do this. I have to get up and brush my teeth. I have to go to work. You have to stay off the area for the wound to heal. Now, this being a deep wound with infection, there's probably some drainage. You may ask for a vacuum pump to be put on the wound to help pull that secretions out, to help keep that wound clean. That may be an option for you, and it may not. It will be up to you and your healthcare provider to see if that is the correct treatment. There are a lot of ointments and different dressings, and there's just a whole plethora of ways to treat pressure injury wounds. So the way that your wound is treated is going to be unique to your situation. talk to your healthcare professional, ask them what all your treatment options are so that you can get a good understanding of why they're doing what they're doing. Sometimes they put some gauze packing in there and they pull the gauze out real quickly, which helps to remove some of the eschar. That's what it's called, the substance that is dead tissue within the wound, because your body is going to get rid of the dead tissue. That's a normal part of the healing process. And so you put the moistened, usually with saline, gauze dressing, you pack it in there and then you pull it out, and that removes some of that eschar, like the wound vacuum would do, but at a different rate. It's more sharp. You don't want to cut anything on there. If your healthcare professional needs to do a debriding of that, only they should do that. You should never put anything in there or try to cut anything out of there, because you're going to cut the healthy tissue as well, and that's going to cause more infection. So, just follow their instructions. Also, if you feel like it's not healing up as fast, this wound is going to take, because it's so deep, it's going to take some time to heal. So if you are finding that you don't think it's healing as well, or it's not progressing as you would like, you can ask to speak to a wound care specialist. There's not one in every area, but there's one in most area, and these are nurses that are specially educated in taking care of wounds that are unusual, pressure injury wounds, wounds that won't heal. They're very adept at taking care of this, and they follow it along very closely. You might need to have a home health nurse come in and do the dressing changes for you. There are all kinds of things. The last option, and you really want to take some time to think about this, but the last option is surgery. And in surgery, they will clean out the wound. They will move muscles around. It's a big deal, surgery. They'll move muscles around to provide padding over that area, and then they'll close the skin. Now, from the pressure injury healing itself, or from surgery, you will have a scar. That tissue is no longer elastic. It doesn't stretch the way our tissue is very stretchable. Like you think about your elbow or your knee, you hold your arm straight, that tissue kind of folds up. When you bend your arm, it stretches over your elbow. That is gone after there's a scar of a pressure injury. So that area is always going to be susceptible. Make sure you have really good pressure dispersing equipment. But the fastest way to heal up a wound is to stay off the wound. So sometimes they'll let you go ahead and sit on that. And if that's, okay with your healthcare professional, but the best way is to stay completely off of it. Don't sleep on it at night. Don't sit on it during the day. And that, because every time you add pressure, you're creating more of a wound. So if you can stay off of it, and it sometimes, yes, it's weeks, months to heal it up and to stay off of it, which is a real bummer to your life, because you're just stuck at home in bed, or however well you can get up. If you can get up and lay on your side, not sit on it. So it's very difficult to be in this situation. So remember to keep a positive thought, to be sure that you're getting healing, you're getting treatment so that you're going to get healing, and keep going with that, because it will heal up over time. After surgery, you sometimes have to stay in bed for 9 months. It's not at all 9 months to a year to be bedridden. And a lot of times they will actually make you sign a contract that before we do this surgery, this is what you're going to do. And so it's better to just, as soon as you get even a change in color in that pigmentation, it's better to take a day off work and stay in bed than to have to spend these months and months being isolated and trying to stay off this wound. So be sure you have, when the wound heals, be sure you have very high level pressure dispersing equipment. Even if you have the best of equipment, there's no equipment that can make your chance of a pressure injury zero. You still have to do those pressure releases. So either holding yourself up and off your seat, or doing tilt and space on your wheelchair, turning at night. you have to do all these things to avoid future pressure injury, because if you have another one on top of this one, it's just even more complicated to heal up. So that's kind of a bad news story, but it is that those are the facts. Okay, so the next person's having some serious tone going on in their body. They'd love to have some kind of exercise equipment. What's best? If there's any place or anyone that may have one to sell. Well, I don't know about anybody who's reselling equipment, but there are people online that do resell equipment. Be sure you check to make sure the equipment's in working order before you buy from someone else. Sometimes the people who sell the equipment will not come out and service your equipment once it's been sold to somebody else. So there's a lot of issues with reselling equipment. It might not be set up for your particular body size or your leg length or whatever. I'm not discounting, because a lot of people do pass on their equipment when they don't need it anymore, which is wonderfully generous of individuals. But I'm just saying, buyer beware, because it can be more difficult. So there's all kinds of things that you can do with exercise equipment. If you are trying some of the electrical stimulation, those are some of the products that will become available to people in the year of 2024. So the companies that are working on releasing some of this equipment, it's been used in therapy. It's available to people, but a lot of times insurance won't cover it. But there's new equipment, new companies that are coming out with different things, and they're making sure that they have arrangements with insurance companies that it will be in their, they call it a formulary. It's equipment and medications, but in their formulary, to make sure it's in the formulary for people to be able to get this equipment. That still doesn't mean insurance is going to pay for it, but it's going to be highly more likely that more people are going to get more and more of this equipment. The best thing to do would be to talk to your therapist and see what kind of equipment might work best for you. So for some people, to help with their tone, they might get a standing frame. That is generally covered by insurance. Almost in Medicaid, Medicare, almost all the insurances cover standing frames. Now that won't move your legs, but you sit in a seat, there's a pneumonic pump, or sometimes you get a fancy one, you get an electric pump, and it stands you up and blocks you. So you're standing, and the weight going through your bones helps you with the osteoporosis. The other thing is that that weight going through your body helps fatigue the muscles. So that helps control the muscle tone kind of in a roundabout sort of way. Doing any kind of exercise manually to your legs, if you can't do it yourself, having somebody else. And when you stretch the legs, that's stretching the muscles, that helps reduce the tone, kind of like using the standing frame. But you want to do it very gently, because the more aggressive you are in moving those muscles, the more tone that will be produced. So you want to do it very gently. If you have access to aquatic exercise, so water therapy, that's a wonderful thing to be able to do. You can go to a rehabilitation that has aquatic therapy. Sometimes there are different locations that will have aquatic therapy available to the public, which your insurance may pay for, or you might have to pay for it yourself. Try to get, if you have tone, that cold water is going to cramp up your muscles and it's going to make your tone much worse. So you'll need to use a heated pool. And there's, you can look up heated pools around in your area. And again, very gentle exercise in the pool can help. You want to have a therapist who knows what they're doing so you get comfortable, because being in the water and, not knowing how your body is going to react, you want to have somebody with you that's, on top of what's going on until you get comfortable. And then maybe a family member can learn to do the aquatic therapy. With the standing frame, you can get gliders. So your hands, like skiing. And as you move your arms, if you have arm movement, it will move your legs in a reciprocal manner. And so that's very helpful. You can try, talk to your healthcare professional. There's FES that performs functional movement, and then there's electrical stimulation that helps just control some of that tone. So those are the things that you can do with the tone. You did not mention medications, but there are some medications that help relax the body and calm the tone, but the medications go throughout your whole body. So some people complain of having a little bit of fog because they're on this medication. It takes a while to get used to the medication. Once you build up a tolerance, and after a while, you may need to go on higher medications, but those are basically any kind of movement that you can provide to your body to fatigue those muscles. Those muscles are cramping because there are muscles that push and there are muscles that pull. The muscles come in pairs and they balance each other. The muscles that pull towards your body, this is why you see people with contractures, that their body parts are pulled towards their body. The muscles that pull towards your body are a little bit stronger than the muscles that push your body parts away from you. And so those are over reacting the weaker muscles that push away, that naturally weaker muscles that push away. So that's what happens with that, because your body craves movement. No matter what you're doing, your body craves movement. Even if you don't feel it, your body craves movement. So you need to supply that movement to the body. So it sounds like you're getting on top of this right away, and that's a good thing to do. It could progress, or it could get, you could be better with your movement. Movement might be enough. Movement's enough for a lot of people, but it's not for everyone. Sometimes you need to add some of these extra things on there. So there's a few ideas for that. An additional addendum to the question about the decubitus option. Would the best option be a wound flap? If the wound is so bad that is what it needs to be done, but you have to understand, if you have a wound flapped, it will be months in bed of healing. You can keep trying to heal it. Sometimes the wounds are so bad that the flap is the best option, especially after they get the infection cleaned out, because the infection could come back because of that exposure of the bone. So that is going to be something that's going to have to be worked out with you. It's nice if you could heal it yourself. And by that, I mean your body heal it itself, but it might be to the point that a flap might just be the option. But we kind of talked about that. Down in San Diego, I'm not sure who the best surgeon is in San Diego, but I would check with my healthcare provider. If there's a rehabilitation facility, you might want to call them and ask who they use for their wound flaps. There are people who specialize in this for people with paralysis. And in San Diego, that's a big enough area, and they have enough rehabilitation facilities down there that I'm sure that there's somebody's name who will bubble to the surface. You can talk to the peer mentors, see if they know somebody. You can talk to the information specialist at the Reeve Foundation. They know a lot of people in a lot of different areas. You can call, there's several rehabilitation facilities down there that treat individuals with spinal cord injury. Not all rehabilitation hospitals treat people with spinal cord injury, but call the spinal cord injury place. If there's a couple of hospitals, and there are in San Diego, call both of them and ask what provider. Now, if you call the operator, you're not gonna get a name, but call and ask for the case manager, ask for a nurse, call one of the doctor's office and say you're looking for a recommendation, and see if you can find somebody who is really in tune with spinal cord injury. So I know in the city where I live, there are many people that do them. Well, many, by many, I mean, for spinal cord injury, I will say like 5 or 6. To me, that's many in one city. But there's one name who always pops up. So, ask around, ask people that you know, if you belong to any organizations within that area. There's a lot of support groups for people with spinal cord injury, and there is one in San Diego. So if you look up Spinal Cord Injury Support Group San Diego, and you can type into their blog who's had experience. So there's a variety of ways to get names, and then you can look them up online and see how long they've been doing it, where they were educated, how they were educated. So there's a lot of different things. that you can do to help find somebody that will suit your need. Usually, if you're going to a spinal cord injury specialist for the wound, they will know. Wound care specialists will know different people to recommend as well. Okay, so UTI and nutrition, in particular with supplements. So a lot of people think about their UTI and they want to add some kind of nutritional balance to help prevent UTI. And so the best thing about nutrition is to look what you're taking in. So if you have sugary drinks, sports drinks, sodas, anything that has a lot of sugar in it, a lot of these drinks that you go buy, these healthful drinks that you go buy have a lot of sugar in them. You go to the grocery store. My grocery store has one whole bunker, a huge bunker of just these health drinks, and they have a lot of sugar in them. Alcohol tends to promote UTI. Sugar promotes, bacteria love to live on sugar. So alcohol has a lot of sugar in it. Caffeine is another predominant factor that UTIs love to thrive on. So you want to eliminate those things from your drinking intake. Now, not always can you do that just, okay, I'm not going to drink coffee anymore when you've been drinking it for years. Iced tea has a lot of sugar in it, or a lot of caffeine in it. Sodas. So sometimes you can't just stop them right now. You get a really bad headache. You feel horrible. You need to withdraw from these. They're really addictive substances. So you really need to spend some time from withdrawing those. Water is the best. Water can be very boring to drink, but water is the best. Now, there's a lot of supplements. You can go online. There's a lot of supplements. Just be careful of what kind of supplements you're taking. Always check with your healthcare professional, because sometimes people think, oh, it's over the counter, so I can take as much of this as I want, but it might affect some of your other medication that you're taking. So check with your healthcare professional. They can also tell you if that particular supplement is going to help you. So there's a supplement that I see advertised on TV. People say, oh, I've talked to people who say, oh, I've taken that supplement and it works wonders. And I've talked to people who say, oh, I've taken that supplement. It did nothing. Know what the supplement is actually for. So there's a supplement that's advertised on TV for urinary tract infections for women who get urinary tract infections from sexual experiences, from having drying in the labia from older age. So there's a lot of causes of UTIs that women get in particular, and that is what that supplement treats, not necessarily the bacteria that you might get into your bladder from doing catheterizations, or if you wear incontinence pads, that keeps the moisture right there, and sometimes people get infections from that kind of thing. So that's why we always recommend a good bladder program where you can empty your bladder. Sometimes people who have catheters in, or suprapubic catheters, get more infections because of the catheter being in there, and that allows more bacteria to enter the body. So, you might need different kinds of things to treat those types of infections. So, the treatment for you, if there's any kind of prevention treatment, you will want to talk about that. Somebody has written in also, what are the over-counter remedies for bed sores? It's like the UTI treatments. You go online and there's a whole bunch. Some people really like one, and other people say, oh, I use this and it didn't work. For pressure injury or for any kind of treatment, you really just want to keep the area clean and dry. So that would be the number one treatment. A lot of people want to massage the area. That's adding more pressure. You're making it worse. Putting on a lot of lotions and treatments can make it worse. So you want to be careful about what you're adding to that. There's some people who, and I don't recommend any products, but for a while, the product called Noop, N-O-O-P, was very, very popular. But if you have a red spot you need to stay off that area. Or if you're darkly pigmented and you have a purple spot or you have a white spot, you need to stay off that area. So staying off the area is the best treatment situation. If you get a change in pigmentation, staying off the spot is what you need to do. If the skin is open, then you need to cover it with a clean dressing. And you might need some kind of medication or ointment if the wound has progressed to even a deeper sort of wound. So is there a certain diet that can help with the healing of wounds? Well, let's talk about that and UTIs. We talked about eliminating sugar, alcohol, and caffeine from the diet when you have continuous UTIs. When you have continuous pressure injuries, a higher protein diet can help. And you can look up, I know I posted a while ago diet supplements that are needed for pressure injuries in one of my blogs, but it particularly had increasing your protein. Always check with your healthcare professional to make sure that that is the thing that's okay for your body. But for all of these kind of things, there's all kinds of stuff. There's the bladder management and nutrition information that's just popped up with links to that in the chat box. So thank you, Beth. So those are the kinds of things for UTIs and for nutrition. There's a lot of online things, but basically you want to stick with what works for you, what works in the medical field. If there's something online that you think might work for you, check with your healthcare professional if it's UTI or pressure injury to find out if you're making it worse or if you're helping yourself. So those are the things. It's really hard. There's not a product that I can say this is the answer. There just is no product because people metabolize differently and they do things differently. People who have chronic pressure injuries and chronic UTIs usually have those not because they're doing something wrong, but because the autonomic nervous system, the part that makes the body work automatically, is injured with spinal cord injury and with brain injury. It can be injured. And when the autonomic nervous system's injured, it's not often reacting as quickly as it should. So a lot of times people feel like, I'm doing something wrong. It's the autonomic nervous system that's misfunctioning. So never feel like if you're not catheterizing yourself, if you're not doing pressure releases, then yeah, you're going to increase your risk of UTI and pressure injury. But if you're doing all those things and it's not working, it's that autonomic nervous system. So you have to think about ways that you can stimulate that. And that is research that's going on right now. They haven't figured out the key to managing that, but when they manage that, it's going to affect UTIs and less UTIs, less skin breakdown. It's going to affect colds and flu. It's going to it's going to affect tone and how you react to that because it's all controlled by the autonomic nervous system. So those are the things that people are looking at right now. Okay, good question here. I'm alarmed by the side effects of osteoporosis treatment proposed to me. I found weightlifting data based on exercises for osteoporosis. They're at a C5-6 injury level, and they can do these exercises with adaptions. Well, first of all, if you have osteoporosis, you don't want to put more strain on your bones. So one of the things before you get a standing frame is you have to be checked by your healthcare physician to make sure your bones will hold up your body. The same thing with doing exercises or doing even gentle movements. So people who have brain injury or spinal cord injury, either from trauma or from disease, need to have bone density tests to test to see what their bone strength is. Because when you're not putting weight through your bones because you're sitting most of the time, that's when your bones tend to leach that calcium. Now, it's the autonomic nervous system. Not everybody does. A lot of people do. So they get osteopenia, which is the beginning of problems with bone density, or they get osteoporosis, which is very, very fragile bones. It looks like a honeycomb of your bones. And when they have that much support material taken out of the bones, they're not going to hold up your body. And so putting resistance against those. So if you need treatment for osteoporosis, you should not start an exercise program because you're going to break your bones doing it. I mean, it's that's as serious. Now, I know that the complications from osteoporosis treatment frightens a lot of people. With injury, with paralysis, or without paralysis, a lot of people are like, oh no, this sounds really too much. But it is the way to build up your bone density until it becomes strong enough that you can do the exercises and you can do the standing frame and you can do these kinds of things. And that will help maintain your bone density. So you might need to be on the bone density medication for a while. You might need to be on it for a long time. But you might need to be able to be on it for a while to build up your bone strength, to be able to do other things to help protect your bones. So it's a vicious cycle that you can get in. So I'm glad you're asking about this because we want to get you out of that cycle. We want to get those bones healthy. And then it sounds like you're motivated and ready to go. But don't just go out on a tear and think, well, I'm going to increase my bone strength. If you already have osteoporosis, you're going to fracture your bones. And that's going to be a horrible mess because it's when you have the osteoporosis and the bone is fractured, what they will do in a healthy bone is they might put a plate in there to hold the bone together while it makes what they call a callus. So you get a callus on your skin, you get a callus around the bone, but it's a callus of bone, and the body will heal that fracture. If you have osteoporosis, there is no place to put that plate in because there's not enough solid bone to connect one end to the other end. So then you just have to sit with a cast on until that heals, if it heals. So it's really a good thing to start taking that medication and to get that taken care of first. Okay, so that's the way that works. Advances in recovery. Well, as I talked earlier, and I'm going to combine this with this next question. If your spinal cord is bruised, can it heal? The bruise can heal, but the bruise may have put pressure on the delicate nervous tissue, which maybe has caused more damage than just the bruise. So the answer to your question is, sure, the bruise can heal, but the damage may have already been done to other tissue. It's the same thing in the brain. If you get a bruise in your brain, there's just no room for that extra material that's in the bruise, the extra blood. As there's no room in the spinal cord, there's no room for that bruise to be. So the only thing that can accommodate that bruise is the very delicate nervous tissue, which collapses under the pressure of the bruise. And so that's where a lot of the problems come. So can these things be healed? And what are the big things that are coming up? And as I say, there's a lot of big things that are coming to fruition. The biggest thing right now is the FES, and a lot of companies are working on this. The Reeve Foundation has supported a variety of companies. So look, there's a variety of companies that you can look at. There's Spinex, Onward, Anuvo, and there's a couple others. There's some European companies. I have questions. People will ask me about getting this FES from European countries, and yeah, you can get it from European countries, but why? You're going to have it here in this country in the very near future. So traveling to another country and then going back and forth, that can be cumbersome because you're going to have it in your own backyard very soon. So that is the big thing. Putting the electrodes on the skin over the spine has made a huge difference in the function of people. Is it the way you were before you had your injury or before you had your disease? No, it is not. Okay, let's put this out. There's no magic, you're all better. That's not there yet. That's years off. But this has improved the life of so many people with putting these electrodes over the spinal column. It's improved hand function, it's improved breathing, it's improved heart rate, it's made for less orthostatic hypotension, that dizziness that you sometimes feel when you get up. It's helped people with bowel and bladder control. It's provided leg movement. So it does all kinds of things. Now, it's not the panacea. The movement I'm talking about is improvement in function, but it's not like it was before. So some people are all into this and they're like, get me one of these right now. Okay, that's that group of people. Some people are like, this sounds very interesting. I'd like for it to be out on the market for a while, and then I'll make my decision. And that's a good decision to make as well. Some people are like, I'm doing well with the way I am, and I want no part of it. My life is just fine. I see no need in it. Perfect. So you need to make these decisions for what you want to do and how you want to do it. Now, there is a site that you can go to and see what the Reeve Foundation has been working on with all kinds of things. It's SEI Symposium. SEI Symposium. You're going to see it coming up in the chat box here pretty soon. And so you can go to that. You can see all the different things they're working on. So there's the FES is the big hot thing right now. I know a lot of people have been wondering about other kinds of things. There's implants that people are doing. So they're still doing the implantable FES. The Cleveland Clinic has this really unique idea where they are putting in controllers in different parts of the body. So if you need hand function, you get one controller, and I'm probably not explaining this as efficiently as they do. But if you want to add on leg function or bowel and bladder, it's kind of a modular system. So you can add on, start with one, add on others, and adjust that. You have Elon Musk with his project where he's doing brain implants with FES. So the FES is quite the hot ticket right now. Now and then there's people who are doing, we had on Dr. Raymond Anders, who's doing diaphragmatic pacemaking, so that you have electrodes implanted into the diaphragm that will help you breathe, to help you get off the ventilator, so you don't have that burden and the health risk of breathing on a ventilator. That's been quite successful. Diaphragmatic pacing is what that's called. We did a professional webinar on that one, and that's really great. We have other people that are working on phrenic nerve pacemaking. We have other people that are working on vagus nerve stimulation. So those are all implantables in the body that are helping with different things. Vagus nerve stimulation can help with arm function, but it also helps. It's being used right now for depression. So if you have a problem with depression and you need some arm function, you got a twofer there. Not to be glib, but that seems like it's going to be helpful to a lot of people. There's been a lot of talking in the past about stem cells, and that always comes up. And I want you to be aware that people are still working on that. It's a very, very, very complicated process. And so people are actively working on that. So we'll have to wait and see how that goes. There's a variety of medications, a variety of devices that are all coming to fruition, hopefully in the year 2024. Now, they have to go through government review, and, things get delayed, and it's back and forth and back and forth. But these things are like just at the tipping point. So we're going to see a lot of things going on in this new year. But you can see what the Reeve Foundation has been working on with that at that symposium. It's highly scientific, but it'll give you some ideas of the companies, and you can look up the companies and go to their webpage, and they'll have a consumer friendly page there. So that's kind of another thing. Also, we have coming up on January 10th, right around the corner, 2 p.m. Central Time, there's going to be another professional webinar with the Spinex Corporation to talk about their pediatric FES stimulator. Now, you think, oh, I'm an adult, so that wouldn't apply to me. They have a pediatric device, they have an adult device. So anything you learn about one is going to be kind of learning about the other, kind of. So just because you're an adult, don't think you won't learn a lot from that particular webinar. And if you do have a pediatric aged individual in your family, you might want to tune into that. Doesn't mean that you're obligated to this, but knowledge is power. And you might listen to this, you might learn more about it. Again, there's going to be people who's going to say, I'm all on board. There's going to be people who are going to say, I want to look at this and see how it turns out. And there's going to be people who say, I don't think this is for me at all. And that's fine. But knowledge is power. Learn about these things so that you can get more and more information. Okay. Somebody wrote in about the FES stimulation and where can they get more information. And so you can get more information on the professional webinars there. The FES thing, as I said, is going over really, really huge. They want to know who's working on it around the country. Well, every major spinal cord injury, brain injury, stroke center is working on it. Every single major center. Now, your local community hospital is probably not, because they have a different focus. They're taking care of the needs of the general population. But everybody is, so both the two spinal cord injury hospitals, Craig and Shepherd, have programs with it. All the major hospitals, Kessler, the Miami Project, Baylor down in Texas, University of Washington, Mayo Clinic, out in California, they have several places that are working. So it's all over, my friends. So that is something that's going to come up. The next question is about wound care, and we talked about that. They're even using electrical stimulation in wound care to help with healing as well. So that's a new thing that's out there. And you might go to a facility where they know about that. You might go to a facility where they're unaware of how to do those particular treatments. So there's just an abundance of things that are going on with the electrical stimulation. As I say, it's not the cure, but it can help with so many things. It can, I recently was interacting with a gentleman that I know very well, and he'll know if he's listening, probably is. He'll know I'm talking about. And he got an FES device only for a clinical trial for 6 weeks. Now, when I first met him, he had little to no hand function. And after 6 weeks of using that, he has hand function. And when he stopped using it, the hand function never went away. Now, it all depends on what kind of injury you have, if it's complete, if it's incomplete. There's just what kind of injury it was. There's a lot of factors in there, but there's a lot of promise going on with this right now. Again, I don't recommend any product over another. And I can't even say that FES is the end of the line. It's not. This is just a start to learning more and more. But as it becomes more available to more people, it's going to become available to more people. So what I'm saying is, the more people who get it, the more people who are going to get it from the insurance companies and the payers. So there's a lot of promise there. So with that, I have to say, thank you. It's been a wonderful year. We are going to have a great year coming up. We'll have these webinars the last Wednesday of every month. So any question that you have, be sure and write in. You can contact me directly if you want to ask me a question, just between you and me, and I'll respond. There's a button on the Reeve Foundation. It says Ask Nurse Linda. You press that blue button, and that's working out really well. And then we have those professional webinars every other month. Again, this one coming up is the Spinex company talking about their devices, and especially that pediatric one. And we have other really fascinating professional webinars, which everyone is welcome to attend. Like everything at the Reeve Foundation, all the services, all the information is freely given. So, it costs you nothing. You can listen to it and decide, hey, I want that, or hey, I don't think so. So it's all up to you. So I hope you have a wonderful new year, and I'll see you again next month.